As you mentioned, my name is Olivia Zollinger. I'm from Switzerland. I'm a lawyer by training, have a business background and a strong passion for health, life sciences, and entrepreneurship. Swiss Healthcare Startups is a non-profit organization, has been around for 5 years and is supporting startups to connect with the right partners at the right time. Swiss Healthcare Startups, as I just mentioned, is supporting startups that are looking to add value to Swiss healthcare by bringing them together with the right partners at the right time. When I talk about partners, I talk about representatives from the entire ecosystem, such as pharma companies, insurers, healthcare providers, service providers, and investors. As you can imagine, when we bring them together through that, we do support the startups that develop digital health solutions and also other solutions to bring those solutions to the market and to the patients faster and better. If I look at the roughly 500 startup members of our association, I do see that most of them, if not all, actually do have a digital or a tech component in their solution. Now, the elephant, the majority of the solutions can be summarized or clustered into digital health, like a keyword of current times. Digital health, in my perspective, are solutions that have a patient in the focus. And there we do see many or much activity in the area of telemedicine, of teleconsultations, of remote monitoring solutions. That includes age-tag solutions. It includes self-management, self-care, anything that actually empowers the patient and gives him or her autonomy back for his or her health decision-making and management. In addition to digital health, there are many solutions developed that shall address problems in the area of e-health. E-health for me is more provider-centered and includes more process-oriented solutions. Last but not least, when thinking about digital and tech solutions in the healthcare space in Switzerland, we do see significant activity in the area of medtech. Medtech has also gone through and is still going through some challenges, particularly in Switzerland right now, as with the regulations having changed in May of this year, Switzerland has lost the direct access to the European market. But we're confident that many of the solutions that are being developed in the area of medtech are still addressing and solving the problems that are currently out there for patients. Again, when looking at the activity in our startup environment, we do see that games are being used in the area of rehabilitation, also in the area of diagnostics, and in the area of lifestyle. And that I'd like to highlight 3 startups that we have in our membership base that are doing so. First, there is Syntract. Syntract is a startup that aims to make rehabilitation more entertaining and also efficient, using an intelligent glove with sensors that patients can use as controllers for games and rehabilitation exercises. There's also Pandox, a startup that sees itself as the first all-in-one health game that uses advanced gamification technology and many different challenges to promote a healthy lifestyle. Last but not least, Advanced Science, a startup member of our association, that develops and applies software solutions using game-based psychometric instruments that optimize performance of diagnostics in healthcare. The first important step is to recognize the need and the benefit of collaborations with startups. And there we see two models. We see major corporations that actually allocate resources and build internal teams that take on that job. We see other major corporations that identify the need and benefit of collaborations and work together with organizations such as with healthcare startups that help them identify potential collaboration partners. Now, what we see is important when we really focus on the how is that openness and interest is really important to identify the relevant matches between the major corporations and the startups, because sometimes only through exchange and communication ideas can be developed that actually build the foundation for value to be generated for healthcare. Last but not least, important to mention is that both sides, the major corporations as well as the startups, do need to have an awareness of potential cultural differences in their organization. We do believe that through that awareness, it is possible to overcome these differences and turn the collaboration into a positive outcome. I'm super excited that Swiss Healthcare Startups is going to be featured on TECHCONEWZ, and whatever you're doing to support interested organizations, be it small organizations such as startups all the way to large corporations, for them to come together, collaborate, and with that generate value for health, not only in Switzerland, but globally. We're excited about that and want to support that. Thanks again for the opportunity, Michelle.